Hi, Anna.
Hi, how are you?
I'm well. How are you?
I'm excited. It's not so often that the podcaster becomes a podcastee. So I
I love
feel
it.
I feel actually a little bit more relaxed. I trust you fully. I know I'm in great hands with you. So I'm just gonna sit back.
Thank you. I
Yes.
wanted you to come on no matter what, but I did have the opportunity and the honor to be on your podcast,
Yeah.
and I couldn't help myself but ask a bunch of questions. So I was like, you know what? Let me pause on this and let's have you come on so that I can ask you.
Yeah,
And I'm so happy to have you here.
me
I
too.
I love the work you're doing. So why don't we start
Mm.
with why don't you tell everybody what is the work that you're doing?
Oh yeah, thank you. Yes. So as an OB, and part of what you and I got to talk about on my podcast is as an OB-GYN, I have the honor of meeting people in these really intimate moments, these one-on-one moments as they come into clinic and we have these appointments. And I've recognized that over many, many years of practice that in these one-on-one moments, I meet people in these the highest of highs, but also the lowest of lows.
Mm,
And when you're going through these really pivotal moments in your life, whether it's emotional or physical or mental changes, you oftentimes feel really alone. And sometimes it's hard to recognize that you're not the only one going through that experience. And so, born from my frustration and my sense that we can support people in their pregnancies and postpartum so much better was this idea of a podcast that as I probably went home too many times venting to my husband who is an entrepreneur, he tends to say, okay, well, if you are going to be frustrated with something, why don't you turn that frustration into passion, into something that's productive? And so the podcast is my chance to create a space for women birthers to not feel so alone, but more importantly, recognize that there are many others kind of going through that same journey, that arc from preconception through pregnancy, through postpartum and beyond, and also be a vetted source of information. I always say to my patients, my pet peeves are, or my arch nemesis, if you will, are nurse TikTok and Dr. Google, because there's a lot
yes.
out there that's overwhelming and not necessarily factual. And so whether I'm interviewing other moms who are experts in their own birth experience, and that's validating, or interviewing experts in the healthcare field like yourself, that information is empowering. That is the information that can kind of dissuade and push away the fear and anxiety that so many people bring into their pregnancy and postpartum experience. So hashtag goals. That's the goal of
That's
the
what you're
podcast.
doing. Yeah, that's what you're
That's what
doing.
I'm striving for, at least.
And I think, I want to get into a little bit what it's like to be a Black woman in the OB-GYN
Mm.
community as a doctor, as
Yeah.
a physician. And really there, I mostly come from the infertility space, as you know. We know that, mortality rates for Black women, pregnancy mortality rates, health mortality rates are much higher.
Mhm.
And within the infertility community, it's pretty commonly known that the numbers of Black women going through infertility treatment are much lower,
Mhm.
particularly because I mean, there's a huge number of factors, but one of them being I think they don't feel they have the right person to go to. It's
Mm.
um it's not talked about as widely from what I understand
Mhm.
within the Black community. And so I'm just curious. I think your podcast sort of extends itself from what you're doing in your business as well, because
Mhm.
people feel great and better when they're reflected in their practitioners.
Yeah.
Do you find that, well, let's start with what has it been like, and what was it like when you knew you wanted to be an OB-GYN for you as a Black woman to head into this
Mm.
path?
Thank you. No, it's such an honor to kind of reflect and remember my journey, because I think so much of like the day to day is just like putting out fires. But when I sit back and think about what brought me to this moment, um, I remember specifically during undergrad, I was in one of my like courses for my major. So I was a human biology major. It was considered like the fuzzier form of medicine, like the hardcore techies and really smart kids did like chemistry and biochemistry. I was smart, but not that smart. So I
Hmm.
did human biology. And I remember, I know I grew up, my father is a physician. Both my parents immigrated from Nigeria, and I grew up so proud of him, right? That he, a Nigerian immigrant, was a physician, well known in our community. And we grew up in West Virginia. And great, guess what? Not many Black families in West Virginia.
Yeah.
And so I just he was a huge role model for me. He stood out, and I saw so much strength in what he was able to offer his patients in our community. And so from an early age, always knew I wanted to be a doctor and happened to, like math and science. So it really felt like it was an easy, not easy. I worked hard, but it was a simple calling, if you will. And then med school, or sorry, college was really hard, right? So I mentioned those really hard courses that they put out there to kind of weed out the weak from the strong. And biochemistry was hard, chemistry was hard, physics was even harder. But in my human biology major, I was taking a whole cadre of courses, and there was one course in particular that spoke to health disparities. And even though I grew up as one of the few Black families in West Virginia, I was still young and relatively sheltered and didn't really have that exposure to health disparities that I then came to know in my undergrad course. And I still remember the paper that we went over. It was a paper from the New England Journal of Medicine. And basically, the paper compared West African born women, so Nigeria is in West Africa,
Mhm.
compared to African Americans in the US, compared to white Americans in the US. And basically, by comparing the birth weight, so the weight of their babies, it was their own kind of metric for pregnancy health. And
Mm.
in one generation, if you compared the African born woman to the US African American woman, their birth weights drastically changed. The babies weighed less, which is a sign for potential, maternal health in terms of nutrition, placental health, etc. And for me, sitting there in this course, surrounded by all these other classmates, I felt like that paper was about me. I thought about my mom, who was born and raised in Nigeria, and had my sister and I in the US, but then my sister and I going on to have our own children, and understanding that somehow in one generation, being in the US, systemic racism, microaggressions, all these insidious things that can affect people of color can drastically affect your health and your
Mm.
health trajectory. And so that was when I got fired up. I hopefully you could feel it right now. I
I
feel my heart
do.
racing.
Yes.
Like it's a reminder of my journey and why I'm here, and that I immediately got fired up and I was like, no way, right? Like, how is this okay? And what can I do to not only change my own health trajectory, but more importantly, have a broader impact? And so that started a whole path of me kind of seeking out coursework that was related to health and health disparities. I think at the time I thought I was going to be a pediatrician, actually, because I was like, okay, like, yeah, I really want to make sure that kids are as healthy as possible. And I remember meeting with a research mentor at the time, Paul Weiss, this amazing pediatrician at Stanford. At least he was at Stanford at the time. And I was telling him about my dreams and my passions. And he was like, well, you seem to really care about the outcomes of pregnancies. And like, yes, you want the children to be healthy, but in order for those children to be healthy, the moms have to be healthy. And he was the first one that kind of planted the seed to
Mm.
be in women's health and OB-GYN. And I was like, oh, okay, cool, Paul, but no, you don't know me. Like, I think I still want to be a pediatrician. And whenever there's a path for you, there's going to be plenty of people along that path that are going to keep you on track. But then when I got to medical school, fast forward, I had another mentor as a preceptor. So it's like who you train with when you're doing your first clinical rotations. It's like the very first couple of weeks of medical school. And you're a doctor, but you're not a doctor yet. You just are basically like you watch a bunch of House and you think you know what you're doing.
Sure.
Anyway, so I'm with this guy, chatting with him, and again telling him about like my passions for health disparities, and like really wanting to make sure that the health and well-being of children is starts from like the moment of conception, if you will. And so talking to this person, he was just like, okay, I'm hearing you, but you sound like you should be an OB-GYN. I was just like, I should. And it was the second time someone reflected that back to me. And I give Paul Weiss, and I don't remember this preceptor's name, unfortunately, but I give him credit too, because that was in medical. By the time I got to medical school, I really then focused, and I became like one of the leads in our OB-GYN focus group. I did everything I could. I did research abroad in women's health, because I was like, okay, well, then this is it. Let me understand women's health, specifically obstetrics, not only as health disparities affect us in the US, but even on a global scale. And the rest is history, if you
Mm.
will.
Amazing.
Yeah.
So the thought of becoming an OB-GYN as a Black woman, did you even think to yourself, I don't know if this is the right field for me? Or was it like once you committed to becoming a doctor, it didn't matter
Mm,
what kind of doctor you became, you were like, I am going to do this. My father did it. I am going to continue
mm,
this. Or,
yeah.
what was that like for you?
Yeah, I would say as a person of color, and especially as a woman of color, I mean, I hinted to microaggressions. So microaggressions are the things that are unseen that you're up against, right?
Hmm.
Versus the macroaggressions are the things to your face. And so there were plenty of macroaggressions. So I remember, and I recognize my privilege in that I had two immigrant parents who from day one ingrained in my sister and I, like education is number one. So I like that's all I knew was to focus and work really hard in school and fortunately I really liked it. But I still remember when I got to college and, was amongst the different pre-med kids. And a lot of these kids went to way better schools than me. My sister and I grew up in the burbs outside of Richmond, Virginia, but I have friends who went to like some of these top really fancy dancy schools outside of LA that I like Harvard Westlake and like
Oh,
friends who
yeah.
went to these fancy I knew you'd know that one and some of like the schools that like Obama's daughters went to outside of DC. So all these things are like those kids like had a whole different kind of metric in terms of their educational support. And so showing up not only, a girl from random place in Virginia, let alone a black girl, I still had a lot of confidence from my parents. So I was like still like, okay, I'm a smart kid. I can hang, I think. Um, but I still remember like, one of those really tough courses, I think was biochem that almost got me where I like kind of bombed a test. And I told my mom, I was like, Mom, I think this is a sign that I'm not meant to do this. I think I'm gonna pull out pre-med track. And that woman, Grace
Mhm.
Nseo, my hero, that woman got on a plane from Florida to Stanford, California, literally that day. I remember her texting me like, I'm at the airport. I'm taking a taxi to your college campus. I was like, what? She's like, I'm going to spend the weekend with you. You are not dropping a pre-med. I believe in you. And like, try not to tear up on this podcast, but like, gosh, I love her. I love that she saw that in me. And I think what was hard getting to Stanford was again seeing all these other kids with academic and social privilege that I never had, even though I recognize I was still blessed and had a great family. And my dad was a doctor, right? And other kind of more macro aggressions I was up against. I still remember it was probably the summer in between my junior and my senior year. I was studying for my MCATs. I was doing research with that pediatrician, Paul Weiss, that I mentioned. And I was a Stanford tour guide, which was like a rite of passage at Stanford. If you were a tour guide, it was like it was something really to be proud of. Anyway, so it was my summer gig was being a tour guide, and I was taking a group of tourists from up to Hoover Tower, which is like the tallest tower at Stanford campus and has like this really beautiful view. And then on the way up, like the guests like to ask questions to tour guide. So one of the guests asked me, like, oh, what's your major at Stanford? What are you aiming to be? And I was like, oh yeah, I'm pre-med. I'm gonna be a doctor. And this woman who did not know me decided, oh, okay, well, it's really hard to get into medical school. So it's totally okay if you go to medical school like abroad, the Caribbeans. Have you heard of those? And like, no offense, I know people who went to school abroad, like they are great physicians, they are
Sure.
my friends. But this woman decided, looking at me, that I wasn't going to make it. I wasn't going to get into an American, like a US medical school because looking at me, she
Wow.
didn't matter that I went to Stanford and somehow that should have been a vetting process that made me legit enough for her. But she looked at me and she decided, yeah, I mean, maybe you got into Stanford because of XYZ, but you can't cut it in medicine. You're going to probably end up in one of those international schools. And listen, Abby, and listen to that random woman. I'm
Yes.
trying not to swear.
You
Guess what?
can.
I went to one of the best medical schools in the nation. I went to UCSF. And so, at the time, I remember her saying that to me. I was like, what? And should I be thinking about applying to schools? Because my list was,
Hmm.
I was going to apply to, I had my safeties, I had
Hmm.
my reaches. UCSF was definitely reach, and so happy that worked out.
Hmm.
But I didn't have a plan to have any of the other schools, like the Caribbean schools or other programs on my list. That was never a plan. But I mean, those macroaggressions add up over
Yes.
time.
Okay, good. I
But
was
that
going to
was,
confirm. I'm like, to me, that's
yeah.
a macroaggression, not a
Oh
micro.
yeah. Oh
You
yeah, yeah.
agree?
That
Okay,
was
great.
macro.
I'm
She
like,
slapped
that
me
is,
on the
yeah.
face.
Okay, great. Just making
Yeah,
sure
yeah.
I'm on par here. Okay.
Yeah, yeah, yeah. Yeah.
Wow, wow, wow. I
Yeah.
mean, and think about to this day, I'm sure you remember it so clearly, how you
Mm,
felt, what it was like, where
yeah.
you were. It's just crazy.
Yeah, and part of my story too, to pay homage to all the people who lifted me up. My mom who flew in that one weekend, my sister, my dad who was like an early example. My sister is also a doctor. She's a badass and she's 2 years older than me. So she's always a person who was encouraging me, saying like, "Hey, this is where I applied. This is how I did it." And I remember literally calling my sister that night and be like, "Hey, so like we had this whole plan. You've given me a lot of advice, but should I be applying to other schools?" And she's just like, "No,
Mm-hmm.
don't like
Mm-hmm.
do what we've planned. Like if heaven forbid you don't get in and we have to come up with a backup plan, then maybe the next round. But like, heck no, who is this woman? Right?
Oh,
Like, and so
yeah.
much of my story then as a learner, as a future medical student and then medical student, OB-GYN resident to now is always in the back of my mind. I'm like, okay, how are people seeing me? Like I know my pedigree. I know I went to some of the best schools. I know I it's an honor to do my job, which means I'm as well read as I can be, I'm as skilled as can be. But there's that moment when I walk into a clinic room where someone's just taking me in
Yeah.
and how much of how I look is part of that at that initial assessment, right? That's it's a weight that you carry everywhere you go.
That's really hard. It sounds really hard
Yeah,
to have to
yeah,
carry that weight.
yeah.
And I think about the trailblazers you share family with, but also that
Mm-hmm.
you are. I mean, tell us about the practice that you've built. And people, I mean, I was curious too. Obviously, people can look you up anywhere and know what they're walking into from a
Yeah,
physical standpoint,
yeah.
that you're a woman of color. But to me, that's so like comforting to women of color to know, like,
Mm-hmm.
I can't be me if you can't see me kind of thing. I can go and
Yeah.
feel myself reflected in my doctor. That do you feel like you get exponentially more women of color as patients, or is it the same? And and then let's just talk about in general this beautiful practice that you've built and
Yeah.
what makes it sort of different than your regular run-of-the-mill OB-GYN office.
Yeah, yeah, great questions. So I would say that yes, I think I'm sought out because not only because of my pedigree, but what means a lot to me is who I am and being a person of color. When I graduated from residency, I was pretty torn because as I alluded to, I was really um I was drawn into medicine, let alone women's health, because of my interest and passion for health disparities. And there's different ways that you can approach that, right? You can stay in academics and do a bunch of research. You can choose to go and practice in what we call like um, federally funded clinics, which tends to naturally serve the underserved because those are patients who tend to be under or uninsured, or you can practice in the East Bay, which is where I practice. And so I remember as I was, interviewing for jobs and thinking about what my job post residency would be, I think there's a part of me that's like, oh, I should stay in academics because that's what I know, and I should do a bunch of research, and I should do a bunch of research that proves health disparities and maybe can help, dismantle health disparities. But I realize, or I can just practice what I preach, or I can go out there and serve these women. And yes, research is great. And again, I know a lot of amazing colleagues who are doing research in that space, but I think what was true to my heart was actually just being out there. And so when I found my practice and was able to join this practice, it's a large women's health group in the East Bay, as I mentioned. So we mainly serve Oakland, Berkeley, and Richmond, which is kind of further East Bay. And this is a really diverse patient population. It's a really diverse community, right? That San Francisco brings in some of the smartest, most kind of ambitious people in the area, but San Francisco is expensive, which means
Mm-hmm.
that very appropriately people are moving to the East Bay, and the East Bay is one of the actually most rapidly growing populations in this area in Northern California. And so I find that day in, day out, like I am serving my purpose by just showing up at work. I have had countless patients, whether it's the elderly, like 78-year-old woman who's coming in to talk to me about menopausal health, and it's just like, I've never had a doctor that looked like you before in my
Mm,
entire life,
mm.
to the young woman who literally lived in San Francisco and drove across the bridge just to get her visit with me,
Which we
or
all
the
know if you live anywhere near San Francisco, that's a big
yeah.
deal to drive over the
Yeah,
bridge for medical care.
that bridge. Yes, that bridge can be a barrier for
That's
many
right.
reasons. And so crossing that bridge says a lot. Or the many other women who are just like, I've been looking for you. I've
Mm,
looked you up. Or, there's, oh yeah, we've heard about you in our like group chats of like women of color at Facebook or Apple. Like it means a lot to
it's a
know that
lot.
I'm here to serve the community. And every time a patient opens up and shares that to me, I tell them I literally became an OB-GYN to care for women that look like me and everyone else, of course.
Hmm.
But I know it's that much more special for someone who looks like me to be cared for by me. I think it creates a space of safety, and anything that I can do to improve and maximize the health of women of color will always pay forward to everyone else. Like the way I connect with my patients of color is exactly the way I turn up for everyone. And
Right.
so they're getting the best version of me every time.
It's incredible. Are you delivering
Mhm.
babies?
And I'm delivering babies. I do it all. That's why I love
Oh
my
my
job. So
gosh.
like in one day, like I said, I'm talking to someone about menopausal health and like how to get that vajayjay,
Mm-hmm.
like working well
Hmm.
all through our 80s to, birth control for my teens. And then I have my OB patients who I get really close to, that I get to, if I'm lucky, to deliver their babies on call versus
Yeah.
doing their C-sections. And then if you got fibroids, you need a hysterectomy, or you whatever else is in that kind of women's health cadre, I get to do it all, and that's a
Pretty
pretty
incredible.
pretty special privilege for sure.
Wow, wow, wow.
Yeah.
You alluded earlier to speaking with your sister about when you become mothers, whenever that timeline
Mm,
is. And
mm,
I don't love asking people this question because I have no idea what their personal fertility journey is all the time, but I
yeah.
am honored to know a little bit about yours.
Yeah.
Are you willing to talk about
Oh, I'm
where
an
you
open
are in
book.
that? Okay, great. Like,
Yeah,
let's
yeah,
talk about
yeah.
where you are on the journey to potential motherhood.
Yeah. So, if we're going to be super duper honest, part of what I love about being an OB-GYN is I get to see a lot.
The good and the
And
bad and the
the
ugly.
good, yes, the good and bad
Yes.
and the ugly, and the good and the bad and the ugly, it stays on you in various ways. I think when I was like a trainee, I was like, oh yeah, I'm definitely gonna be a mom, probably gonna have two kids, and just like, I just need to get through my training. And once I get to that place, like, let's start a family kind of thing. But now, many years into practice, where I really, really see how hard it truly is, and how beautiful but trying it can be, again, from preconception through postpartum. I think for me personally, it caused me to take a step back of like, wow, when am I going to be really ready for this?
Hmm.
Then you add, my other half, aka my husband,
Yes.
who has his own personal kind of angst and reasons that he's ambivalent about parenthood,
Hmm.
and starting a family. And so we are both equally in line in terms of our like, okay, not ready for right now.
Great.
I'm honest about our percentage split, in that I'm probably like, I waver between being 70% like pro and ready for kids, to 30% to 80 to 20. And
Hmm.
he definitely wavers between like, 50-50,
Yeah.
sometimes 60-40,
Yeah.
sometimes 30 pro, like 70 not, right? Like we're
Yeah.
people.
Well, and you said he's an
Um,
entrepreneur, which is its own
yeah.
form of parenthood. You're birthing whatever your
Hmm.
business is, that there's so many ups and downs. I think that has a lot to do with it too.
Yes. Yes. Thank you for seeing him. Oh, you're so
Yes.
sweet, Abby. Thank you for seeing him. And you're right. Part of our general discussion as a team, as a kind of partnership, is figuring out like his stability when it comes to his birthing companies.
Yes.
But we decided this past summer, and by we, I said mainly I, because I'm an OB-GYN and I know about my
Yes.
own reproductive potential, and I know what
As
my
you
ovaries
should.
are doing.
Yes.
And so I am empowered by that. That is also a privilege to understand that. But I got to a point where I'm 38 years young, and even though I'm younger now than I am tomorrow, I'm still getting older. And so I decided last year, I was just like, to my husband, I was just like, okay, this is the year that we probably should just invest in future potential, and we should probably bank some embryos. We talked about it. we both agreed that that was a rational thing to do. It made a lot of sense. And then I did my own research. What's hard about practicing in the Bay Area is that you care for tons of people who work in these amazing tech companies and these amazing tech companies that have a lot of great fertility coverage because
Yes.
that's the way that they support their workforce, which I think is excellent. But
Hmm.
guess what? When you're an OB-GYN, you don't have the same fertility coverage. I have no
Yes.
fertility coverage,
Yep. Of
none.
course.
Of course.
Of
And
course.
so I remember reaching out to my colleagues and friends who are fertility specialists and, talking about what my thoughts were, asking them to give me a breakdown of like what to expect in terms of timing, costs, and even with their kind, referral, discount, it was still going to be tens of thousands of
Yeah.
dollars that yes, we have, but did I want to spend it?
Right.
So I chatted with my husband, especially because we don't know yet if we would use these embryos. And so when I chatted with my husband, he's like, wait, one of my really good friends, like honestly, a childhood best friend of his, is a fertility specialist in Turkey. He's like, let me chat with him and see how it'd be if we do this in Turkey. And I am very pro
Yes.
global utilization of healthcare forces. I think something that's trending is actually getting hair transplants and nose jobs in Turkey. It's very
Yes.
funny. If you ever fly through Istanbul, the whole plane is like
Yes.
nose hair. But who knew that my husband's, childhood bestie, who's now an amazing fertility specialist, had actually just joined a private practice out there right when we were kind of deciding. He's like, yes, your family, come out here. We'll give you like the family discount, $3,000 for everything.
No
And beyond,
way.
yes. And beyond just cost, I mean, I'm an
Eh,
OB-GYN doctor, which means I also, now that I went through everything, like absolute highest standard of care, great quality of care, amazing team. And because we were a family to him, we'd walk into this clinic it's a very popular clinic and it's in Ankara, which is like the capital of Turkey. Very popular clinic, a lot of like a lot of international clientele, probably for the same reasons that I made my decision. Anyway, we walk in and he'd be like, "Oh, you guys are here. Come to my office. Here's some Turkish tea. Here's some Turkish delights." Like they just would treat us so well, and I felt so held, and so
Yes.
I felt very, very, very lucky to not only have such a great experience, but also to financially be able to make a decision for us because if we do thaw those embryos and use them. And if we're lucky enough that something sticks, then there's a chance that we're paying for, very expensive private school or
Yes.
something of
Yes.
sort. So I thought of
Something.
it as a future investment
Yes.
in both ways. Like I can save and I can also utilize those tens of thousands of dollars for this future kid or kids, if they so exist.
Incredible. And you kind of
Yeah.
got a little bit of a vacation out of it. You're
I
stimming, you're
would say
stimming, so it's
yes,
not,
stimming,
yeah.
exactly, exactly. I mean, so it was, we always go to Turkey. My husband goes to Turkey probably like every year to visit his parents. I try to go like every other year, and I really like genuinely love my in-laws.
Mhm.
So like during like 2 weeks of stimming, feeling like very, very bloated, they have this like sweet little apartment on a beach, like a little beach town kind of outside of Bursa, which is like one of the bigger cities. And so I would sit on their little like rooftop, looking at the sea and just like holding my bloated belly. So yeah,
Yeah.
it was a bit of
Yeah.
vacation, but it was nice. It was nice.
I mean, so many women I work with have to feel that bloating and all the things and go to work.
With work.
Or, yeah,
No,
it's
totally.
like, it's crazy.
I realized like how lucky was it that we already had this trip planned, but then kind of added some days here and there on either end with everything. But how lucky was I to be able to just like pause work,
Yes.
say like, oh, I'm on vacation, but by the way, I'm actually gonna, take hold of my future fertility.
Right.
And same thing, like if we end up using those embryos because of laws in Turkey, we
Right.
can't bring them outside of the country. And so
Hmm.
if we end up using them, same thing, I'm gonna be, taking vacation, quote unquote,
Yes.
to, start a family.
Yeah.
So yeah, I'm very lucky that I can take that time off. I actually have no idea how I know people do, but I walked away from that experience with so much empathy. I
Mhm.
already have tons of empathy, right?
Yeah.
But so much more empathy because it's not only how time intensive it is, how anxiety provoking it is. I think I shared this with you when you were a guest, but I remember freaking out when like a droplet of medication
Yes.
ended up on my skin and thinking like somehow that will mean the egg retrieval won't be nearly as successful. All of that stuff.
Right. And that's from an
Goodness.
OB-GYN. I
Yeah.
mean, that's what's crazy, right? You know better or whatever that,
Yeah.
and this is the anxiety that this whole process causes. And the stakes are so
Yeah.
high. You're just doing this for sort of insurance, which isn't even better.
Yeah.
Like the stakes, so many women are at the end of their rope when they're doing it. So add that to
I
the
know.
mix and it's completely insane. I think most female OB-GYNs that I know stopped delivering babies once they became moms.
Mm.
um, because of the insane hours and the calls in the middle of the night. They just couldn't do both. So I'm just thinking for you of the pros and cons because you genuinely love both. And I think it's an interesting conundrum that we have to face as women in that market, in
Yeah.
that field, you know?
Yeah. No, I mean, I always say that OB being an OB-GYN is you know the field for me for all the reasons we talked about so far, but because it is such a wide breadth of what you get to do, and I think it's unique in that you can choose to be at any point you could choose to be like a gynecologist only versus an
Right.
OB only, and that's one of the things I think is a saving grace for so many people because your life changes. I have colleagues who actually choose preferentially only to do OB, like doing shift work at the hospital
Mhm.
is actually allows them to be like, hey, I only have these 2 shifts a week. All the other time I can use to focus on my family. That's what works for them, right? Versus those who say like, nope, the wild hours of OB don't work for me. I'm just going to do my clinic work and surgeries on the side. And it's hard. I think that one of the many reasons why I chose the practice I did, besides the beautiful diversity that is the community that I get to serve, is also the flexibility. I walked in and I saw a lot of amazing role modeling from my colleagues of all the different ways that they did it all, if you will, quotes, big quotes,
Yes.
um, as mothers. And so I saw some of them who like, change their clinic schedule, some who still are taking OB call, but they don't do weekend call or, all these different variations. And so that's one of the things I really trusted with joining my practice. It's like, okay, if and when our family starts, I'm going to have that flexibility. And right now I don't feel ready to give anything up, but I think one of the reasons why I personally continue to kind of wait in terms of starting my family is because I know that that's going to change my life in the biggest and best way.
Mhm.
And I'm excited for that future version of myself. I'm excited for how I'm going to evolve. And that evolved Anna might be someone who's just like, you know what? Yeah, I'm done with major surgeries like hysterectomies. Like I don't need that anymore. I've done enough of them. I'm going to focus in on that, right? But fortunately I've chosen a field that will let me continue to define and redefine myself. And that's exciting to me.
Everything. I think that's so
Yeah.
important. And it is a privilege to have sort of the hindsight, but ahead of time, the foresight, I guess, to know
Yeah.
what you want and know how you're going to want your life to balance as a doctor. I think it's incredible.
Yeah.
Where do you see, we'll just do one last big question and then we can
Yeah.
sort of pull it in. But um, there are so many challenges in the healthcare system right now, especially for women.
Mm,
I mean, between abortion rights, access, right? Like infertility, fertility, all the things.
mm.
Where do you hope we go? And like, what's your part? And how do you feel like you can take control of any piece of sort of the shit show that is our American healthcare system right now? Just a little small
Woo!
question, you know?
Yeah, just tiny, tiny light question just to end it all. No,
Yes.
man, ooh, that's a great question. I'm gonna take a pause and see
Take
how
the
I want to
pause.
answer.
Yeah.
I
There's
think
there's no
for
wrong answer.
me,
That's the good news. Anything you,
exactly.
yeah.
Exactly. I think for me, because it comes up so much. I think for me, it all comes down to self-empowerment and agency, which is why I get so angered and passionate about anything related to, abortion rights because it's someone's body. It's someone's choice to do what they will with their body. It's the same way I feel about how how can we help support patients through their fertility journeys, let alone their pregnancies and postpartum periods where there's a lot of external information coming to them that is either correct or incorrect and makes them go in with so much fear. Like Abby, I can't tell you how many appointments I've had when people just rather than, talking about like what to anticipate or how to improve their nutrition or health in pregnancy, where we're just trying to
Mm.
combat like the fear and anxiety that people have,
Yeah.
let alone postpartum, where a lot of my passion lies in terms of figuring out how to create and recreate that village around you. Like to me, the ultimate themes are self-empowerment and agency. And so I think those are all things that are like a large umbrella within women's health. And I think that there are different ways to support that goal. I think my podcast is one of my ways of trying to do that, right? By having these realistic conversations about things so that people can walk away feeling strong, feeling like they understand, they understand it from other perspectives, let alone expert perspectives. Um, I think that a big passion of mine, which, oh, if you know anyone in the government, let me know, is parental leave, right? I think that when
Mhm.
I spend so much time in that postpartum space, trying to support people the best I can, and I can't do it well enough, but I think if we actually prioritize family in the way that we say we do, and the we being society, the we being our country, I think we put a much stronger emphasis on parental leave, right? Like I had a patient who I just saw this past week, who's ready back to work, 6 weeks postpartum, has a toddler at home plus this newborn, and that was just her only option. She's just like, oh, I don't think I'm ready to be back yet, but we have to be back because this is what her family needs financially, right? But like, no, of course she's grappling with like mild postpartum depression. Of course she's feels exhausted at work because it's been 6 weeks. Her body's not ready for it
No.
yet. She's emotionally and mentally not ready for it yet. So of all the things in this large umbrella of women's health that I'm that much more focused and passionate about is probably postpartum health. And I think a a big uh shaker of that would be redefining parental leave and extending it for all, right? I know, again, a lot of friends who are privileged to work in these large tech companies who get 3 months, 6 months, 9 months, a year, but I
Paid,
care
paid,
for paid.
paid.
But the patient in particular I just gave an example of is a woman of color.
Hmm.
And that was not an option for her and her
Yeah.
family, right? Or unpaid time off was not an
Right.
option for her and her family. So for me, um, my biggest thing will be any way that anything that benefits the most privileged populations has to trickle down to the rest. That's why it has to likely come from like a governmental federal policy metrics that will affect everyone. Because right now it's only those of privilege, and I'll put myself in that category of privilege, even though I don't have great insurance coverage, even though I'm a doctor. And I actually know from my other colleagues who've taken time off, like we actually don't get that much time off either. But
Right.
there's so many who have way much more privilege. And so if I can use my privilege as a physician, as a well-educated physician, to to advocate and work with policymakers and change makers to create any system that can help support families, specifically women postpartum.
Mm,
Oof, because that
mm.
trickles down. Like,
Love
you
that.
know this, Abby, because your kids are home from school right now, but
Yes.
you are foundational in your family. Every other friend or sister or cousin that you know, there's something very special about the maternal figure in every family in every community. And I firmly believe that by focusing in on that person, that will trickle down and benefit larger and larger communities and circles.
Mm, I think that's the perfect note to end on. So thank you for
Yeah.
wrapping us up so beautifully. I want to ask you one last thing, which is there any advice you give your patients or that you were given from your mom, your family, and your sister that you think about on a daily basis?
Mm. That's so sweet.
It could be a
Wait,
cliche, it could be anything.
yeah. Yeah, I mean the probably the cliche is probably from my mom, who's like literally the happiest person in the world. But yeah, it really is like believe in yourself. Like I said, I couldn't if you asked like I remember how old I was at the time, 19-year-old Anna, who was like crying about biochem at her Stanford dorm years ago, that I'd be talking to Abby on this podcast right now. I wouldn't have believed it, right?
Yeah.
So like my mom flying in and saying, I believe in you, literally holding my hand and saying, I believe in you, that's carried me through many, many challenges and will keep carrying me through. So yeah, as corny as it is, believe in yourself.
That's such a good one. I mean,
Yeah.
so good.
Yeah.
Anna,
It's a
thank you so
classic.
much for being here. We'll link out to all of your stuff, but you're the
Yes.
best.
Oh, thank you. You're the best. Really appreciate you. Enjoy the rest of your day.